Good evening, and thank you so much for joining us. I'm Samantha Mesa.
And I'm Josh Berry. We want you to take a look at a map from the CDC. As you can see, Michigan, it's very red, meaning flu-like illnesses were very high for the week ending January 25th. The CDC ranked us among the top 15 states nationally for cases of influenza. Only a handful of states in purple reached the health agency's highest level for flu-like illnesses.
According to the CDC, more than 20 million Americans have gotten sick from the flu since October. About a quarter to half a million of them were hospitalized. Unfortunately, 11,000 to 53,000 people have died. Now remember, it is not too late to get a flu shot, and that is your best bet. If you ask a million people for flu remedies, you'll get a million answers.
At noon tonight, our Walid Alamla looks to dispel some of those myths and let you know about some strategies for taking care of your health you may not have considered.
This time of year, you'll hear your coughing and your sneezing, and with flu-like illnesses on the rise across the country and here in the state, it's important to know how to treat those specific symptoms that you're feeling. It's cold season in more ways than one, and people like Aurora are already starting to feel it.
First I felt cold, and then Daddy and nobody else felt cold. And then we were wondering if I was sick, and then we found out I was sick.
And it's spreading to the whole family.
We were pretty much achy. We had runny noses, we had coughs. The cough was probably the worst.
The Brunos aren't the only ones. Federal data shows influenza is going around, and if you're coming down with something...
Yeah. Okay, pharmacy.
Pharmacists like Mike at Case Pharmacy in Grand Rapids have been helping folks for decades.
But this time of the year, we certainly see a lot of that. As it gets colder now, we do see more of those cold and flus coming through.
There are treatments aplenty.
And so you can take like a NyQuil. It's okay because it has antihistamine, which you don't really need. It's got alcohol, which you don't really need, kind of to knock you out.
But Mike says to feel better faster, treat your symptoms.
But why take something for the drowsiness when you don't need it? And why take more acetaminophen when you don't need it?
So if you have a cough, what would make you feel better?
Are you trying to bring the cough up, or are you trying to calm it to stay down? There's some expectorants for that kind of loosen the phlegm up a little bit.
And if the congestion is elsewhere...
Is the head stuffy? Well, then that would be like a Sudafed as a decongestant.
Then check and see if you have other symptoms.
Then the cough sometimes will go into a sore throat. Then there's throat sprays, lozenges. Then you're getting into the Tylenol and the Motrin there just for the pain.
And if you're confused about what to take, ask an expert.
What I prefer to do is I've got at home, I've got, 5 or 6 different things. And when I need something, it's like, I'll take that for that symptom.
If you listen, you'll hopefully be back on the ice in no time.
We're good now, right?
Feeling better now? Awesome. Mike recommends if you're in and around the public setting often, whether it's for work or for any other reason, getting your shots up to date will not only help you, but help stop the spread as well. In Grand Rapids, Walid Adamna, Fox 17 News.